Just wanted to thank you both. I'm with RSL midfielder Kyle Beckerman and infectious disease specialist Dr. Kashif Memon from Steward Healthcare. And thank you for making time to speak with Kyle and I, give us a little update on the current situation here in Utah and answer some of the questions we have. I have a ton. I'm sure Kyle has a lot as well. So things have been just rapidly changing. Every day it seems like you wake up, there's a new situation, a new state. Just could you start with just the current state of affairs here in Utah? What's going on as of today?
Yeah, first of all, thank you for having me on the show. And current state of affairs in Utah, we've been lucky, I would say, so far. We don't have too many cases. I think our average at this time is around 600 cases. We have 2 deaths so far. We have several patients in the hospital. Some are on ventilators, some are on high flow oxygen. None of the patients I'm taking care have died, and let's hope that it stays that way. So we haven't been hit like New York, Louisiana, New Jersey. I think I'm hearing something there as well. Some of these states are being hit very hard.
So why is that? I know that everyone talks about the peak and flattening the curve and all of that. Are we behind New York, or do you feel like we're in a different situation? What is it?
I think we are in a different situation. New York obviously is the biggest city in America, most heavily populated. It's densely populated. People live in high-rise buildings, multiple apartments, same port of entry, the door, the elevators, everybody has to go through that. So if there are a few infected there in that building, they're going to infect many if people don't take precautions. And obviously in the beginning, nobody was thinking about that or doing social isolation. So it has spread like wildfire over there. And things are different here in Utah. We don't have multiple high-rise buildings. We don't have dense population. Mostly people live in townhomes or separate homes, and there are some apartment complexes too, but nothing like New York. So I think we hopefully will not be as hard hit as New York, but I don't think we have seen the peak yet in Utah. I think our peak would be somewhere around like mid-April. The whole month of the April, like the government is saying, I think is accurate. I think we will suffer. The whole country will suffer, including Utah, for the rest of the month of April. And after that, things will slowly die down. We might have a second wave or third wave they're talking about once people start coming out of social isolation and distancing. But those waves would be weaker and smaller compared to this initial one.
I guess just on protocol for when we go out and we have to go to the grocery store, or I've heard kind of conflicting stories. Some I'm hearing we should be wearing just a regular mask, surgical mask. And then also I'm hearing that maybe you shouldn't. And I was just to kind of clarify, like when we go out to the grocery store and do the things we have to do, what precautions should we take?
Yes, that's a very good question. And some countries are doing that and they have a lot of success. One country that comes to mind is Denmark. I think South Korea has done really well, but they also have done excessive testing. Somehow they were lucky they had enough testing supplies. They have tested their people like crazy, and they had very low infection rates and mortality. So here in the beginning, the CDC and the government, the problem was that we didn't have enough PPE or personal protective equipment for the hospitals and healthcare workers. So, and everything was running out. You couldn't find all these supplies at the stores, at the shelves. So they said, only people who are high risk, people with chronic immunocompromised systems, people with diabetes, people with heart disease, lung disease, or over the age of 60, these are the people who have to be careful, and they should use masks and extra precautions when they go out in public. Not everyone, but now we've been hearing that CDC soon might come out with this recommendation that everybody who goes out in the public places should wear a mask. So my take on this is this: 2 things. If we have enough supply of masks for everyone and people use the mask the right way, I think we should all use it. I mean, that's the bottom line, really. So the supply issue, obviously the masks, the disposable surgical masks that are used at the hospital, not the N95, those are not supposed to be used by general public. The disposable ones, they are not enough available. So they are recommending people can use the homemade cloth-based mask and all kinds of improvisation. And that is fine. Those masks are not as effective, I'll have to say, as the surgical disposable masks, but still they will give you protection. If you ask for comparison, I would say the surgical disposable masks are like 3 times more protective than the cloth-based mask that we can make at home. So, and then the second aspect is wearing it right. So I even see patients, family members, doctors, nurses even don't use the mask the right way. You know, they don't seal at the top. So the air, the breathing in and out from outside and inside is escaping. So it's not giving you the protection. Plus people keep touching the outside of the mask, which I call the danger zone. So when you are breathing outside with the mask, all these droplets of this virus, if they're not going inside your nose or mouth, where are they going? They're stuck on the outside. So that outside of the mask is the danger zone. So if we touch that now, our hands are contaminated and they become a vehicle to transmit the infection. So if people do it right, they don't keep touching the mask, don't keep adjusting it, we have enough supply, I think all of us should wear it. And also, I would like to mention that when somebody wears a mask, at least you are not the person getting more protection. Actually, others are getting more protected from you because they are being protected from your droplets. So that's the whole idea. But if everybody wears, obviously we're all protected from each other.
Yeah. Okay.
Just on top of that, you kind of talking about the fact of wearing the mask it's more about maybe protecting what we could be giving to other people. A lot of people are asymptomatic, have it, but don't know, and are putting people in that higher risk population at harm's way almost by doing that. I'm just curious, and just to touch upon the whole mask idea, but also the reason why we're really being encouraged to stay at home, to flatten the curve, just for people, because again, there's so many different news sources and different ways to get information. Just for people here in Utah, where we're one of the last states without a statewide stay-at-home order, why it's important for all of us to be staying home. It will be the sooner that we'll get to watch this guy back out on the field again, but why we are trying to flatten the curve, because what that does for you and other people working on the front lines right now.
So the idea is that people, before even getting the infection, signs or symptoms of infection, 1 to 3 days before that, they can transmit the virus. And it can transmit from that person who's totally asymptomatic very effectively to other person. And we have heard even talking, not just coughing, not sneezing, coughing, just normal conversation can also throw out these droplets and other people can get infected from those. So that's the whole idea, to not give it to other people, especially the younger people are more asymptomatic. So they are at higher risk for others. So that's the whole idea. And the flattening of the curve, there are 2 schools of thought. One was that England tried in the beginning, but when they saw excessive deaths, they backed down, is that let the infection go through the country, like rapidly. Most people get infection. Most people get infection. They will eventually become immune to it. Now we will have herd immunity, and our social distancing, our kids staying at home, people not going to work, working from home, our economy, everything will improve in a quick succession rather than it will take time. But to do that, we'll have to pay a price. Our healthcare system will be loaded with patients, sick patients, patients in the ICU, patients on the ventilator, and we would not have enough resources to deal with that. It will break down our healthcare system. So that's what we're trying to do, the flattening of the curve. So the epidemic will last longer this way. We will have all to suffer. It's a sacrifice, and we all have to sacrifice longer. Our economy will suffer longer. But I think in the end, we might see less infections and we might see less deaths in Utah. And maybe that's what's happening. That's why our numbers are not so bad at this time.
Because in flattening the curve, essentially you're trying to avoid overwhelming the healthcare system, the hospitals, and having a situation where you can't even hook up someone that needs a ventilator to a ventilator.
That's correct. And then we might come to the situation that we have to pick and choose. This patient is too old, too sick, already has cancer, maybe this patient doesn't need a ventilator, and we don't want to do that. And it might, if we don't flatten the curve, it might come down to that we just run out of ICU beds, run out of ventilators, run out of supplies, and our healthcare providers might become exposed, like happened in Italy.
Right.
I think more than 60 doctors have died in Italy. I mean, that is a huge number.
Okay, so we're staying home. Now what ends up happening is we look to Amazon, different things, and we want to support our local restaurants. How do we go and be safe doing that? I've heard that the virus can stay on cardboard. So if you're getting a package from Amazon, what things should we be doing when we're trying to support local businesses or order stuff online? What should we be doing to stay safe?
Yeah, I think a lot of business has gone online because of that. Amazon, Walmart.com, Walgreens, all those websites people are using for delivery. But then you have a good point that those packages could be contaminated because the delivery personnel have touched that. So I think the right thing would be to get some gloves and pick up that package with that. And which part of the package we're opening, probably we should wipe with Clorox, bleach, or some alcohol wipe, something like that, so we don't get the virus. I think that would be the best approach, and obviously also have a mask on while you're opening it at home. And in terms of,
sorry, I didn't know you were supposed to wear a mask when you're opening it.
I mean, this is for the high risk people. I'm really mentioning, like, really immunocompromised people, and these are the people who are really high risk for infection. But regular people, younger people, kids, I think still we have to use precautions. Yeah. At least the contact precaution when we're opening the package, I think. Getting the businesses back on, I think one idea that is running around that I really like myself is doing the antibody testing. So the actual infection test is a PCR test, which checks for the actual virus in your system, in our nasopharyngeal passages, in our nose. We do a swab. The antibodies are antibodies that are developed in our system against the virus after we get infection. There are two types of antibodies. One is IgM, which rises early in response to infection, and then there's the second one, IgG, which rises late. So if somebody is positive for both antibodies, IgG and IgM, and they have no symptoms, that means this patient is exposed, has been infected in the past, they probably had mild symptoms or no symptoms, and now they're immune. So they most likely would not be able to get the infection again, and they cannot give infection to other people either. So if businesses can test all their employees for these antibodies, and all of the employees are positive and asymptomatic, they can come back to work. So this is the idea how we can get back the country. And for example, Real Salt Lake, the whole team can get tested for that antibody. And people who are negative would mean that they are not infected, they never had infected before, and they will be still high risk, and they need to take more precautions. Okay. And it's a 15-minute test, it's a rapid test, and it's not very expensive. Majority, I believe, are $15 or so. But if the idea is FDA approval, which we haven't seen yet, plus availability of those tests.
Hmm.
So are they available, or?
They are available. There are several websites. FDA has allowed them to release those tests, even though they don't have formal FDA seal on their packages, but FDA has allowed them to release those tests in the situation we are in. So the whole idea is to find those tests. Mm. I myself cannot find it. I looked on Amazon, there is a kit available, but the delivery would be around in the beginning of May, which is too far.
Oh my goodness. What are you doing? Because I think people will appreciate this. You're in the hot zone right now every day. What are you doing to take care of yourself, protect yourself and your family who you're going home to every night?
Yeah, so in the hospital, obviously, we have to use all kinds of personal protective equipment. We have a rule now that every healthcare provider, basically every worker at the hospital, has to have a mask on all the time, no matter what. So that's our policy. Plus, if we're going into the patient who's infected, we're using the hats, disposable hats, goggles, gowns, gloves, everything, even shoe covers when we go inside the patient's room. We've been very careful with that, and luckily so far we have enough PPE at the hospitals. Then when we come home, luckily I don't have any elderly parent or relative at my home who is 60 plus or somebody who's immunocompromised with chronic diseases. It's my wife and kids only. So most of the healthcare providers, they undress in the garage. They have a bathrobe or towel, and then we run to the bathroom. First thing we do before contacting anyone, we take a shower and then come back and interact with the family. And I think most of the doctors and nurses are doing that. And in terms of protection, it's a very good question. What else I'm doing? So how do you boost your immune system? So the things that we all can do is have a good night's sleep. That sleep is very important. It does boost our immune system. Eat healthy, more fruits and vegetables. Take vitamin supplements. Vitamin C seems to be beneficial even for patients who are acutely infected. So you can take vitamin C supplements if you don't have kidney stones. Otherwise, you might have problems. Right. Exercise on a regular basis. We don't have any gyms open, so we just have to be innovative and try to find ways to exercise in or around our houses, and manage our stress. I mean, meditate. Most doctors don't talk about it. Meditation really can boost your immune system. So all of those things I think we can do, interact with our family, do things that we didn't do in the past. Maybe now we have more time with our family. So there's something good that comes out of it.
That's true. Kyle, what have you been doing to stay active? This is probably crazy for you, who's used to having a routine running all the time.
Yeah, I bought a stationary bike so I can work out at home. And yeah, I mean, every time after I work out, it feels great. It feels like, you got something on the day, you accomplished a little something, and kind of get your mental state in a better place. So it's been good.
That's been the hardest part. And I guess we don't want to keep you because we know you are very busy right now helping keep Utah safe. But just outlook wise, what can people here in Utah expect for the next couple of weeks? I mean, for Kyle and I, this is, I think, week 3 of quarantine. So I'm already getting a little bit stir crazy, because the whole setting has been quarantined for 2 weeks, but it's going to be a little longer, clearly. What do you expect? You mentioned the peak or maybe here around mid-April. What should we be doing until then to help? What can we expect?
So I think just like the president said, next 2 weeks, the first and second week of April are going to be very, very hard on our nation, our country, and including Utah. And the remaining 2 weeks, the last 2 weeks of April still. But I think we will reach the peak probably mid-April, then things will start slowing down very slowly. I don't think May would be much easier, but things will be settling down slowly. And I think in summer, we will start to see light at the end of the tunnel. And in the meantime, like I said, the things we need to do the social distancing like we're doing as much as possible. And maybe help out our neighbors or senior citizens who don't have enough help available in terms of going to the mall or the grocery store and get the needed supplies or medications. We can do all those things to help out our community and each other. I mean, we are all in this together. I think together we'll get through this. We will get through this. This will end. Right now, it all feels like doom and gloom, the end of the world, but that's not the case. We have been through hard times. This is one of a kind of epidemic we have never seen before. But I think we'll get through this. I think a lot of people are suffering at the present time, people losing their jobs and going on unemployment. But eventually, we'll get back up.
Thank you. I appreciate hearing that from you. It's reassuring because there's just watching the news gets my blood pressure a little too high and too stressed.
And I would like to mention that, again, 70 to 80% of patients will get mild infection, very mild symptoms, or no symptoms. It's only the rest of the 20% that will get sick enough to go to the hospital, and 5% of those will end up in the ICU setting, maybe life support ventilators. But majority of us will do fine. So we only see the worst case scenario on the news media and TV, people who are dying, people who are in the ICU or been through severe infection. We don't look at the success stories. people who had mild infection or no symptoms and they were infected, they are not holding a placard outside, hey, I had COVID and I'm survived and I didn't feel a thing. If we see those happy stories, I think we'll feel better. We're just seeing the worst case scenario and it's not helping us.
Thank you. I think we all need to hear that because it is true. Everything we hear, usually the most traumatic and heartbreaking stories. So.
And Kyle, my son is in a 10-year-old is in a soccer league, USA Soccer, and he's a big fan of yours.
Oh, cool. You tell him I say hello.
I will.
Cool.
Well, thank you both so much. And Dr. Memon, thank you for making time to answer some of the questions and putting us at ease and giving us some facts as to what's going on here in Utah.
Sure. Thank you for having me.